From KETK, you're watching East Texas Live.
Well, welcome back to East Texas Live on KETK. Joining us now is Sylvia Warren with Net Health. Today we're talking about National Influenza Vaccination Week.
Yes.
Sylvia, good morning.
Good morning.
Very important topic that we need to talk about
Yes,
today.
this is the season, so this is what we need to be talking about. And this is the week of National Influenza Vaccination as well. So,
How did this week kind of come about? Why choose this week of all the weeks?
well, it's an annual observance that we observe through CDC, and so it's there, and they select what week it's going to be each year. So this is the week that we're in. It's a time where we have the opportunity to let people know that it is not too late to get your flu vaccine.
Well, tell me, why is it so important to make sure that we stay up to date with our annual flu vaccines?
Because we know that the flu vaccine changes every year, so we know that the virus changes every year. And so we want people to make sure that you are really protected against the flu. So each year you should definitely get one. If you're 6 months of age and older, you should definitely get your flu shot.
All right. I wanted to talk about some common myths that surround the flu vaccine. One of the ones that I always hear is the flu vaccine that you're giving me has the active and a live virus in it.
Yeah, and that's not true.
Okay.
And right, that is not true. And that's one of the big ones every year. That you giving me this flu shot and it's going to give me the flu. Well, that's not true, because it cannot give you the flu because it's a dead virus. It's inactivated, so it doesn't have the capability of giving you the flu.
What are some other myths? I know one, not necessarily a myth, but this one is true. We look to Australia, right, to see how we want to develop our flu vaccines?
So in doing so, we find out whether or not what strain is going around. So we'll know they will know exactly what to put into the flu vaccine each year.
No, go ahead, I'm sorry.
And they go by that, what's going on there, so we'll know what's going to be happening over here, hopefully.
Yeah. So what are some other myths that you kind of hear that you want to dispel this morning?
I've never had a flu vaccine, and I've never gotten the flu. So, so do I need to get a flu vaccine? Absolutely, you do need to get a flu vaccine, really. And that helps to protect those people who are not able to get the flu vaccine, like those who are less than 6 months of age, those who are allergic to the flu vaccine. The more of us who are able to get the flu vaccine, we help keep them from being ill from the flu.
And like you said, it's a complete coincidence if you get the flu vaccine and then you get the flu.
Yes. First of all, we have to remember that it takes 2 weeks anyway to build up the immunity. So if you get the flu vaccine today, you go around somebody who has the flu and you get exposed, then you very well can get the flu virus, get that disease. But it's not because you got the flu vaccine, but they're going to blame it on the flu vaccine every time.
All right, well, talk to me about the hours of operation for Net Health's immunization clinic and when we can come in.
Oh, okay, we're open Monday through Friday, 8 to 11 a.m. and 1 to 4 p.m. On Wednesday, though, that's our late day, so we're open until 6 p.m. And our phone number is 903-510-5604.
All right, we will get that information posted over to our website. That's KETK.com for y'all to catch up on. Thank you for being in with us this morning and talking about it. So important. We appreciate it. All right, coming up next on East Texas Live, online shopping expected to hit records this year. So how do shippers work around the weather to make sure your package arrives on time? We'll get a tour at FedEx after the break.